adjust the bed to your level of comfort. I'm sure you guys have learned about ergonomics, have you? Proper alignment for you. All right, sir. Hey.
I'm very modest.
Are you?
Yes.
Okay.
Take your boots off.
I take your boots off.
Take your boots off.
Really?
Strip it down. Feet, take the pulses. We want to see it all. We want to see it all.
Yeah, you sure do.
It didn't quite come out right.
It's hard to care for the sick when you are sick. It's probably the most difficult task of all. All right, we're going to pretend like these are note cards. Okay? These are my note cards. All right. So what do we do before we enter our patient's room?
Hand
hygiene. Morning, Mr. Daniel. How are you? My name's Becky. I'm going to be the nurse taking care of you today. I'm sorry my hands are wet. I'm just getting all cleaned up here for you. So I'm going to check you out head to toe. A couple of things I need you to do first, though, is we're going to have to get you out of the bed.
Okay.
Okay? So hop on up. And if you wouldn't mind just walking towards me, good. And turn around and walk back the other way and stand over there on that white X I have for you.
I'm too close.
I'm going to have you hold this up to either eye of your choice and look on this chart here. And if you wouldn't mind reading the top line first and proceeding as you can.
EFPTOZLPEDPECFDEDFCZFFELOPED.
Can you stop for just 1 second, Mr. Danny? Can you repeat this line for me, sir?
FELCFED.
Okay. And can you repeat this line for me?
EDFCEP.
Okay. And this one?
PECFD.
All right. And switch eyes for me. We'll let that adjust for a second. There you go. And start right here where my finger is.
PECFD. EDFCZP. FELOPZD. DEP. POTEC.
All right. Thank you, sir.
Okay.
I'll take that from you. And now what I want you to do is stand here in front of me. And your feet about shoulder width apart, hands at your side. If you wouldn't mind just looking in my eyes. Good. Now close your eyes for me. Okay, good. You can open your eyes. Now turn around. Feet about shoulder width apart and just bend at the hips, keeping your knees straight and let your arms hang in front of you. He doesn't have a shirt on, okay? Okay, good job. Now you can have a seat. If you wouldn't mind just facing that way.
All right.
Drop that foot down for you. That looks highly uncomfortable. There we go. A little flatter on that end now.
All right. That's the bed.
Now what I'm going to do is just kind of check out the head and your nose and your ears and your neck. I'm just going to kind of feel around too, okay? Any of this tender?
No.
Okay. Okay, good. Skin's warm. That's good. I'm sorry my hands are so cold. What about in here?
No.
Okay. Here?
No.
In here?
No.
Nope. Okay, good. The protrusions and lymph nodes. We're going to make sure that we check all of the lymph nodes in here. Any pain or tenderness with this?
No.
What about coming up through here? No? Okay. Alright, here when I press?
No.
What about up in here when I press?
No.
No? Okay, good. I'm going to come from behind you here, and I'm going to feel your throat as you swallow. Alright. And count of 3, I want you to take in a nice big swallow. 1, 2, 3. Good. time. Okay, and can you turn your head to the left? And can you turn your head to the right for me? Perfect. Alright, I'm going to put some gloves on because I'm going to look around in your mouth, okay? Mask on now that I'm coughing all over the place. Huh?
So much.
Let me grab one more tongue blade.
And you'll have those supplies out.
They're all going to be out. Good point, yes.
And the way you're talking like this to your patient is expected and part of it.
It's going to be hard, I realize, because you're all going to know what to say and expect from one another. All right, do me a favor and just open your mouth. Good. Okay, good. And can you stick your tongue out for me? Good. Now I want you to take your own hands and pull your bottom lip down. Okay, good. And take your own hands and pull your top lip up. Okay, perfect. Thank you.
And we don't need to say what we're looking for.
You can if you want to your patient. Now open your mouth one more time. I'm just going to press on your tongue. Stick your tongue out a little bit. One more time. Say ah. Okay, good.
Why does it feel so ridiculous?
It does, doesn't it? All right, now I'm just going to grab your tongue, stick it out, and I'm looking all the way underneath it on each side. Good. And I'm going to take this off, and I'm actually going to feel your tongue. Stick it back out for me.
Are you feeling your masses?
And I'm going to go right here too, and under. And here. Okay, good.
Don't dip.
Good job. Now, what I want to do is for you to put your tongue up against this cheek and I'm going to press, and you just resist me pressing. Good. Let's do it again on the other side. Resist me pressing. Good. Now I'm going to, I want to use the new ones.
Spray on there.
I want to look in your nose.
Can you reach or need to move a little bit?
All right, do me a favor and take a deep breath in through that nostril. Good. Deep breath in through that nostril. Good. I'm just going to look around. I'm sorry. Good. I'm just going to leave that on, actually.
Can I ask you a question at this point? If you were to find something so that we could remember it when we go out to document, could you just make a little note? Okay.
Of course. Or you can just take your pen and just make a little mark. Put a star.
Okay.
So that you can know, oh, there's something abnormal there.
Okay.
Well, we're going to need to record things like vision and all that along the way.
You can tape, I'm going to tape a piece of paper on my leg, and then you just, I did that on the job, literally, like put a big piece of paper and just tape it on your
Yeah,
leg.
a couple more of these. Go ahead and pull these down.
That's pretty good idea.
It's working.
You'll see nurses do that all the time. They'll come into work with things written on their legs.
I feel like a camera.
Now, I've already felt your ears. I didn't feel any masses, but I am going to do it one more time. Any of this tender here and here?
Yeah, we're good.
Okay. Now I'm just going to hold this up and thank you. I'm going to look all around. Now what I'm going to do is pull your ear up and out. You're going to feel me pressing in kind of hard. Good.
You don't need to hear us say what we're looking for.
I want you to talk to your patient more than you're talking to me. Don't talk to me. Pretend like I'm not even there. All right, good. Perfect. So now what I'm going to do is give you a little ringing and vibration towards your ear, okay? What I'm going to do is I'm going to put this on the bone right behind your ear, and you're going to feel a vibration, maybe even some noise. Tell me when you no longer hear that,
All right.
okay?